Hi, Stephanie here with Mahalo.com, and we are continuing our conversation about infertility and some of the procedures and treatments that go along with it. One of the treatments that some women may have had is a tubal ligation, but if you want to get pregnant, of course, you'll need to reverse that procedure. And joining us now is Dr. Jain to talk about how do we reverse a tubal ligation.
So a tubal ligation is a very effective form of contraception. In fact, it's called sterilization, because a portion of the fallopian tube is actually burned or removed, which basically blocks the sperm and egg from meeting. So the actual procedure of tubal reversal is a surgical procedure whereby the surgeon goes in and cuts away the scar tissue and then rejoins the two limbs of the fallopian tube using very, very fine suture stitches. As fine as your hair, actually. It's done under a microscope. It's a very delicate and meticulous procedure.
How effective is restoring a tubal ligation?
Well, for the most part, the damage is only in the area of the tubal ligation. So at the time of surgery, we cut back on the fallopian tubes until we have healthy fallopian tube tissue, and that's what we join. The reality is that the success rates from tubal ligation indicate pregnancy rates comparable to women of that age who never had a tubal ligation. So it's quite successful.
Which leads us to another question. Should women really think twice about getting a tubal ligation to begin with?
You know, regret is seen about 1% to 2% of the time for a tubal ligation. It's difficult to know what the future holds. At the time of tubal ligation, a lot of women believe that they have finished building their families, and it sounds like a very effective and simple one-time way to avoid an unintended pregnancy.
Do you have an age range? In other words, let's say a 25 or even a 30-year-old woman came to you and said, I want a tubal ligation. I mean, do you encourage them to maybe wait a few years?
Yeah, you know, that's a good point. I think once a woman reaches the mid-30s, I think the decision's probably a good sound decision. In the 20s, there's still a lot of opportunity for remarriage or wanting another child life. And there's other effective contraceptive methods other than tubal ligation.
Well, thanks again, Dr. Jain. And if you would like more information about any of these topics about fertility, you can click on any of the links here to my left, or you can subscribe to Mahalo Parenting. I'm Stephanie Stanton. Thanks so much for watching.